Hello, my name is Mary Stern and I'm a physiotherapist here in North Vancouver, and I'm coming to you today with clinical Pilates and clinical Pilates in the context of a physiotherapy session. So some people don't know what clinical Pilates is, and I do have a video on what that is. But it is another tool that a physiotherapist will have that will help to provide a change in movement, a change in that sensation in the body, that can provide a full body core integration experience that will really leave you walking out of here feeling a little bit better, more in tune with your body, stronger. I do translate that to some homework or activity that you'll usually be doing at home that's meaningful. And I will sometimes incorporate dry needling, manual therapy during the movement or apart from the movement. So it is really a holistic physiotherapy session that you will be getting, but with the specialty of clinical Pilates, which is powerful, very transformative. I've experienced it myself. And as I mentioned, I will be the patient in this scenario. So today we'll be doing a mermaid exercise. And what this will do for me personally is will help just to open up this area. I get a little bit tight through the QL, so this is a stabilizing muscle that attaches to the lumbar spine. It's very deep. It's one of those areas that can get a little bit sticky and can lead also to some dysfunctional movement. So a little more hip hiking, whereas we try to have a nice hip extension moment, and then that hip hiking can kind of take control. There's different ways and that can play into it. But for me, opening up and stretching through that area helps to reduce any stickiness that I get also in the SI joint sometimes when I run. So that's what I'm working on. And through this mermaid posture, I'm also going to be opening up my thoracic spine, which I shared in a previous video. Sometimes gets a little bit tight as a result of an old neck injury. So we'll be doing both of these today. Now it's important to know in a clinical Pilates session, you won't necessarily just be doing one exercise. We may look at it from a few different vantage points, but the most important thing is that you're not overwhelmed, that you get something out of it, that you can take home with you, that you feel empowered, stronger, and more aware of your body. So here we go. All right, so to initiate this exercise, I have my feet planted. There's different ways to do this. We can also come into this kind of internally rotated pose. And actually, let's do it this way today. But you can have your feet planted as well. So I am going to grab hold of this bar, and I am going to place that down to help facilitate my lengthening through my torso. I'm going to lift and expand through my torso without flaring through my ribs. And I'm going to reach up. Reaching up without translating my thorax or translating my thorax, I'm going to reach and expand. So this is going to be an exploration for me. And as a physio, I'm supporting you in your own exploration. I want to walk my hands light to the side because I will be rotating. So deep breath in. And I feel like I want to fast forward this, but it's important not to. And I'll continue to breathe in and almost feel as well like I'm reaching up through the crown of my head as I continue to come off. Now, one of my hip is coming off here, which it actually is, and that's part of the process, doing it a little bit wrong. But that's partially because I've got a little bit of restriction in internal rotation. So as I feel it's coming off, I'm going to now rotate my body, continue to lengthen, and come towards the bar here. Now this is where I feel like, oh, this is a spicy restriction, but it actually feels amazing. Like I'm kind of finally tapping into opening up through the fascia here. So deep breath in here. And if I want to get a little bit fancy or a little bit more mobility for the spine, I can even try to find extension here through my thoracic spine, and then flexion, like a very tiny, tiny, tiny minimal cat-cow through here. So you can see that's not a lot of extension and not a lot of flexion, but what it does is open up those upper T-spine even more, and all the way through the mid-back. I'm keeping my arms stable. You notice I'm not bending that elbow too much, and I'm not kind of hiking and losing stability through the stacker up. Okay, and then I'm going to reach up and slowly come up. So like I said, there's modifications for how you're sitting. If you wanted to sit like so, with feet planted, that might feel a little bit better. If you wanted to even come into this position, and then you might feel a little bit extra lengthening through here, but for me, I feel a little bit too much compression through there, so I'm not doing that today. So there's always different ways to play with it. There's classical Pilates poses, exercises, and we always will modify those. So it doesn't, like I said, there is no idea of perfection, and that's really one of our most, as physios, important principles in terms of the clinical Pilates itself, because really it is about you and it's about empowering you. All right, thank you so much.